Hey everyone, Dr. Siobhan France here, physical therapist and wellness coach and creator of the Knee Strength Maximizer system. Today I want to share with you a morning routine to decrease the stiffness that you feel. So hopefully you're getting 8 hours of sleep at night, and part of the reason why you're feeling that stiffness is because you don't have any pressure through your joints at nighttime. So let's talk about how the knee joint is made up. You've got this bone here, and you've got this bone here, and they meet here in the middle, and there is cartilage that is surrounding those bones. And as the cartilage starts to wear away, then we lose some of that fluid that allows our joints to move and glide the way that they're supposed to. I call the fluid the WD-40 for our body. So as that fluid becomes less and less because the cartilage starts wearing away, then you experience stiffness throughout the knees, especially when the joint is not weight-bearing, meaning you're not standing or walking or putting any pressure through it. So the cartilage acts as a sponge. So when you put weight through it, when you're standing or walking, all of the fluid gets into the joint and it allows the joint to move a lot smoother. And when we are sleeping or sitting down, then all the fluid gets pulled back into the cartilage. And so when we're sleeping at night, all the fluid gets pulled back into the cartilage. So the first few movements that we do in the morning tend to be a little bit painful because we don't have that fluid or that WD-40 in our body. So before you even get out of bed, I recommend doing these next exercises. So while you're laying in bed, you're going to slide your heel on the mattress, just like this, back and forth. And this is just going to help you get some good movement through your knees before you even put your foot down on the floor. Slide it back and forth. If you have issues in one knee or both knees, it doesn't matter. I recommend doing it to both just to keep them even. You're just sliding back and forth, nice and slow. It doesn't have to be fast. You're just going to slide your heel across the bed. Then you're going to pull your knee up to your chest like this. I recommend keeping the other knee bent. That will take the stress and pressure off of your back. And you're going to hold this for about 10 seconds. Then you're going to put this leg down. Then you're going to pick the other one up and hold for 10 seconds as well. I don't recommend holding here. This will compress the knee joint and could possibly cause more pain. So hold underneath for 10 seconds. And then you're going to switch back to the other side. I often recommend doing about 10 of these for 10 seconds and then relaxing. The next thing we're going to do is called a quadricep. And so all we're going to do in order to help get more blood flow into the joints are squeezing and tightening these muscles here. If you've got some back issues, feel free to put your hand behind you like this. You're just tightening up these muscles and then relaxing. Squeezing these muscles and then relaxing. You can hold for about 3 to 5 seconds, and then you can repeat about 15 to 20 times. Squeezing and relaxing these muscles here. And you can even put your hands here to feel that these muscles are actually doing some work. And then last but not least, once you actually get out of bed and put your feet on the floor, I actually recommend doing some marching. And so you're going to stand, and as you stand, you're just going to march in place like this for about 30 to 45 seconds. What it's going to do, it's going to put some weight through the knees, and it's going to allow that fluid or that WD-40 to get into the joint. So try these in the morning before you get out of bed, and then first upon putting your feet on the floor. If you have any questions, please feel free to send me an email or comment. If you guys would like to see any specific videos, I'm happy to make these videos for you. Again, my job is to educate you, let you know that your knees can get better. You just have to give it some time. If you're experiencing pain for a long time, understand that it's not going to happen overnight. It will take some time, but I'm here to help you and answer any requests that you guys may have. So I'll see you in the next video. Thanks so much for watching.